Well, as staff shortages continue to stress Ontario's healthcare system, a new survey is illustrating the impact it's having on frontline workers.
The Registered Practical Nurses Association of Ontario says almost 70% of nurses in Ontario say they can't provide adequate care for patients due to insufficient time and resources. The survey of RPNs was conducted in May, and results say nearly 1 in 2 are considering leaving the profession.
Further results show 93% of nurses said their workload increased over the past 2 to 3 years, and 68% said they don't have the time or resources to provide adequate care to their patients. 66% of nurses said they've had to take on more patients, and 4 in 5, that's 80%, have experienced moral distress. That is up 20% from December of 2020.
Ontario Health Executive Vice President Dr. Chris Simpson says the healthcare system isn't collapsing, but is under immense strain, even using the word crisis to describe what's happening.
Yeah, I think crisis is a fair word in that, when I talk to my colleagues across the system, many senior, very seasoned people are saying things consistently like, I've never seen anything, like this in my career. But the reason I think I steer away from the word collapse is that we are still doing, scheduled procedures in hospitals. Compare that to earlier in the pandemic when we had to stop doing all scheduled surgeries, for example. So the business of healthcare continues, but the pressure and the crisis feel, I think, that we're all feeling on the front line is very real.
Now, the numbers from May show that on average, high urgency patients spend about 4.7 hours in emergency, and 89% of them finish their emergency visit within the target of 8 hours. But the numbers also show that all patients spent an average of just over 20 hours in emergency, and just 24% were admitted to hospital from emergency within the target of 8 hours. Premier Doug Ford defends his government's handling here.
Every single jurisdiction in Ontario is either getting a renovated or a brand new hospital, 50 of them right across the province. We're spending over $40 billion. We're adding a new medical school until we can graduate more docs out of the medical school. We're paying for the tuition for nurses to come on board, and we're trying to give them an incentive. We gave the nurses across the province a well-deserved $5,000 retention bonus. I call it a thank you bonus.
And yesterday, Health Minister Sylvia Jones tweeted about a virtual meeting with the heads of 2 unions that represent healthcare workers in the province, calling for an all-hands-on-deck approach.
So while an executive at Ontario Health is calling the healthcare staffing situation a crisis, neither Premier Doug Ford or Health Minister Sylvia Jones have offered any new plans to quickly address the situation.
So for more on this, let's bring in Amy Archibald-Varley, a registered nurse and co-host of the Gritty Nurse podcast. Amy, thanks so much for joining us again. Yesterday, we had your co-host on your podcast join us to talk about this as well. What's your take on the government's response so far in terms of what you're hearing that they're saying in regards to the situation that you're experiencing every day?
Yeah, I think the most painful thing is not even acknowledging what we've been saying. I think that it would have been, there's so many missed opportunities that this government has to acknowledge the suffering that nurses have been going through, to say that, like we've been saying it's a crisis. We've been saying that this has been a long-standing problem, and we still haven't received that acknowledgement. I don't even know what to say to some of my colleagues when we're having conversations. I was having a conversation just before I got on the call with you with one of my colleagues, and she was asking me, can you tell me about microphones? I'm looking about doing completely different work than nursing, and maybe you can give me some advice. Like, this is where we're going, where nurses are not feeling heard, they're not feeling respected. And at this point, they're saying, you know what, if you don't hear us, you don't respect us, we're just going to leave. We're going to find other alternatives of work.
So, Amy, clearly the results of the poll that we've just been talking about come as no surprise to you. You're seeing this firsthand every shift, every day that you go in here. Are you hopeful at all that the more these sort of things come to light and get talked about, that perhaps that will sort of, rattle some cages, get some more attention to this? Because I'm sure from your perspective, obviously it's stressful, it's hurtful. You're seeing, your colleagues going, you're having these short staff shifts. But I wonder what you hear from the patients that you're treating and dealing with on a day in and day out basis when you can't give them the right care. What do you hear from them?
Mm-hmm. Yeah, I mean, that's actually a really good question. And I think the main thing that we're hearing is about the fear of wait times. And I can only give you like my own personal perspective and some of the perspectives of other folks. For example, I had some issues, gynecological issues, and I had to reach out for care. And I got a date over a year in advance from now. Like, see, these are the pressures that we're concerned about. Like, I'm concerned about my own health. My mom is supposed to have an ablation surgery. That's been delayed. Like, these are the things that all Canadians should be concerned about. Should be concerned about the fact that, you know, you might be waiting for a very long time for a diagnosis because you might not be able to get in for that diagnostic imaging. You might not be able to see that family doctor for whatever period of time. And these are the concerns. And then just the fear of, you don't even know if that unit that you need to go to, the emergency department or the ICU, might be closed, you might be redirected. All of that is additional stress and strain that patients and families should be thinking about. And it's a very scary time. I think to myself that I'm really scared for what health is turning out to be. And I think that a lot of nurses like myself are turning to other alternatives, thinking about other plans, thinking about exit plans. I feel like it's going to get worse before it gets better.
Yeah, that certainly sounds very alarming, Amy. I'm curious to know, are you hearing from patients that they're not getting the primary care with their doctors and that's why they're flooding to the ER? And would having more support help nurses stay at the moment, or is this more long-term as well? I know it's a complex, multifaceted issue. I know the pay isn't right as well, but what's going to convince nurses to stay at the job this moment?
Yeah, to answer your first question, I would say that, like, one of the things I said yesterday was patients are receiving care. So I want people to realize that if you are going to the emergency departments, you are seeking care, you will receive it. What we are advocating for is that the care needs to be timely. It needs to be not under duress, because a lot of nurses are working in really deplorable conditions. I mean, in terms of patient ratios, in terms of the staffing, in terms of, you know, some nurses tell me that, you know, they are one of two that show up to a unit of 30. Like, we're not hearing those types of stories, and that's very concerning. So yes, this is a long-standing problem. And what would keep nurses at the bedside is one of the things I continue to say, and I'm so tired of saying it, but it needs to be said. You need to meet nurses where they are. You need to have these conversations. You need to get out. I said this before, you need to get out of your ivory tower and come down and see the hard work that nurses are doing. The government I think many nurses have been begging Doug Ford to say, you know what, come and spend 12 hours in an ICU. Come and spend 12 hours in an ED and see what it's like. See what it's like to not eat. See what it's like to see patients every second. See what it's like to see patients that need the care that they deserve. And we know that we're shortchanging them. Come out and meet us where we are. And again, no talks of repealing Bill 124. We have been asking for this bill to be repealed. This bill affects and caps nurses' wages at less than 1%. And again, we're not hearing any movement on that. And I think the more we continue to feel disparaged, the more despair we feel, the more hopeless we feel, the more we're likely to leave this profession.
Yeah, Amy, I appreciate the perspective. You know, polls and interviews are one thing, but certainly getting that firsthand glimpse would certainly appear to be something that could help. Appreciate the perspective this morning here on CB24 Breakfast. Thanks for your time.
Thank you.